lifestyle changes for joint health. And this is a topic that comes up frequently in the clinic. Patients ask what they can do to help with their joint pain. And I want to give you some tips today as part of this Lunch and Learn series. If you have any questions, please type them in the chat. I put a message there saying, hi there, welcome to the webinar. But you can type them in the chat as we proceed through the webinar, and I'd be happy to answer those questions. I will periodically check on the questions coming through and do my best to answer those. We're going to spend about 20 to 30 minutes today talking about lifestyle changes for joint health. And if you have any further questions, you can always ask at your next appointment. So, what can you do to support your care in the clinic? Strategies such as exercise, supplements, weight management, stress, and sleep are common questions that I get in the clinic, and I want to make sure that we cover those today. When you come into the clinic, you receive chiropractic adjustments, and the chiropractic adjustments help realign your spine and your joints. They also improve the function of the joints, the range of motion, the nerve flow or the nerve function in the area, and your overall health, because from the spine, all the signals from the brain are going through the spinal cord to all the parts of the body, to your organs, the tips of your toes, tips of your fingers. So the alignment of your body is very important, and the flexibility is very important, and that's what we want to focus on in the clinic. Now, as we do the adjustments, there are some things you can do to help support the changes that we're achieving in the clinic. So there's stretches and exercises, and many different things you can do nutritionally, stress-wise. We're going to cover that today. As the spine alignment improves and your posture improves from the adjustments, the muscle tone in the body is going to change and get better. Because if the spine is straight down the middle, then the length of the muscle on the right and the left side are equal. And when you have more symmetry, your body's going to work better. So when there's misalignments, one side shortens and the other side gets stretched, and that creates imbalances in the muscles, as well as the ligaments and discs and all the tissues that are connected to the bones in the spine and the joints in the body. We use shockwave and laser in the clinic. Shockwave and laser are therapies where the shock wave is an acoustic wave, a sound wave that's generated by the head of the machine, and then it goes into the body, breaking down calcific densities. So if you have calcium deposits, scar tissue, it helps break those down and promotes healing of the tissue in the area. So sometimes I use shock wave, which is a sound wave, to help joints to heal. Other times I'll use laser, which is a light therapy. It's a concentrated light beam that goes into the body. There's two wavelengths, one superficial, the other goes deeper into the body, and it helps to heal the tissues in the area. We do orthotics as well in the clinic, and that helps to support the proper alignment of the foot, as well as cushion the joints, especially the feet, the knees, hips, and the spine. And the orthotics we do are custom made. I do an impression or a cast of your foot in the clinic, and then I write a prescription and send that to the manufacturer. They make an orthotic, send it back, and then that is perfectly made to adjust for any deficiencies of your foot, as well as to help cushion the joints. Oh, and by the way, for the orthotics, we do bill directly to insurance, and orthotics are covered separately over and above chiropractic care. So if you have, let's say, $1,000 of chiropractic care per year, orthotics may be covered for an additional $500 per calendar year. So I'm just using that as an example, and we often check our patients' coverage when they first come in the clinic to see what exactly it covers. So if you're interested in orthotics, please let me know at the next visit. Now, posture. Posture is so important because it can affect joint health, and we want to correct common postural problems. So sometimes we see a curvature of the spine like this, which is called the scoliosis. And Sometimes we see poor posture front to back where the head's forward, and I'll show you that in a minute. And that can cause unnecessary stress in certain parts of the spine, and it can wear down one side of the spine faster than the other, and that's called osteoarthritis, or arthritis for short, and that can break down those joints quicker. So we don't want that to happen, and we want to stop the arthritic process as quickly as possible and reverse it as much as we can to get the proper alignment and the posture restored. So it's kind of like a car, when your tires or your car's out of alignment, the tires on one side are going to wear out faster than the other side. And it's similar to alignment in your body, where if the body's out of alignment, it's going to wear out on one side faster than the other. All right, the next slide is about forward head posture. So often we see something like this, text neck. And the more forward your head is looking down, the more stress there is on the spine. So it's, just simple physics. Your head weighs quite a bit. With gravity, if your head's forward, it's going to cause a lot of stress on the spine. And here, where the neck angle is 70 degrees, 28 kilograms, it's equal to 28 kilograms of force on the neck, as opposed to if your spine is in the proper alignment, head up, your head only weighs 5 kilograms. So the body was designed to distribute the weight equally over all the joints, but as soon as you start to change the angles, the head gets heavier and the amount of force on the spine changes. So I encourage my patients to avoid text neck, change their desktop posture, do what they can to improve the alignment of their spine. One of the exercises I like to give patients, it's called wall angels. Wall angels is when you stand against the wall, try to get your shoulder blades touching, both of them, and your elbows touching the wall. And then you can start in position A with your arms over your head, and then slide your arms down into this 90-degree position in position B here. And then back to position A, arms up overhead, and then back down to position B at 90 degrees. This is an excellent exercise to train your upper back to be in the right posture and to help work on the muscles that help to keep good posture in the upper part of the back. If you're interested in doing some stretches like wall angels, please let me know, because I can give those to you when you come into the clinic. Usually I text my patients stretches specifically designed for them, so I can always text you the stretch. If you're not a patient in the clinic, what I would recommend is talking to your health professional about stretches before you start them or try anything new. And if you don't live in the Kelowna area, certainly you can reach out to me, and you can type in the chat, and I'd be happy to refer you to a chiropractor in your area that does this type of work. I know a lot of chiropractors across Canada and the United States, so I can always refer you to somebody who could help you. Now, for nutrition and supplements, we do carry them in the clinic. I do recommend nutrition and supplements. I'm going to give you an example today, but the nutrition and the supplements we carry can help to support joint health and reduce inflammation. They're anti-inflammatory and pro-healing for the joints. For example, we carry collagen. Collagen helps because it has turmeric and vitamin C. It's anti-inflammatory, and it reduces joint, knee, and back pain, but also the inflammation from the aging process, so the arthritic process. And the collagen we have is chewable form. It has the turmeric and vitamin C in it, and it has all natural ingredients, so it's really good for connective tissue. Today I gave a patient magnesium. The reason I gave him that was to relax his muscles, and it helps with sleep. So it's one of the more common supplements that patients do get at the clinic, and you take that before bed, and it just helps relax your muscles and helps you to sleep. It comes in a powder form, and the magnesium that we carry tastes really good and is very high quality compared to some other forms that are pretty chalky tasting. Now, stretches and exercises. How can stretching and exercises help your muscles increase your range of motion and prevent stiffness? And a lot of the stretches I give out in the clinic are yoga type of poses. It helps to also do cardio and strengthening exercises to support the work we're doing in the clinic. And some of the stretches that I start patients off with are the cat and dog. Here's the cat right here. The dog is the opposite way, kind of arching your back upward, and the cat is arching your back down like this. And then other stretches I like to give to my patients after they do the cat and dog is thread the needle, not shown on this one where there's a twist of the spine. I like twisted roots for the lower part of the spine, wide child to traction the lower lumbar area. And then once the patient gets good at that, move on to a little bit more complex ones like the halfway lift or even the camel for flexion and extension of the low back. So I'm just using these as examples for you because these are some of the stretches that we give to our patients depending on what their problem is and what point, how their progress is, what point in care they're at in the clinic. So if we're in the corrective phase and we're working on posture, some of these exercises might work better. So it all depends on the patient and their specific condition. Now, sleep. Sleep's very important for the healing process because it increases blood flow to the joints. It brings oxygen and nutrients into the joints for repair and regeneration. It stimulates growth hormones that produce muscle growth and healing. Regulates inflammation and pain by producing prolactin, a hormone that reduces swelling and discomfort. And when you don't sleep well and you have chronic sleep loss, it can impair bone development and increase the risk of fractures. So we definitely want to focus on sleep and making sure patients get good sleep. So, sorry, I think I lost my slide there. Good. So, we want to focus on sleep, especially at the beginning of care. When people are in pain, they need more sleep. So sleep posture is important. Sticking to a sleep schedule, going to bed at the same time every night, waking up at the same time, reducing blue light exposure in the evening when you're just before bed. So I'd say 30 to 60 minutes before bed, put away the electronics, try not to watch TV, and just, you could listen to the radio or you could listen to a podcast, something like that is okay. But you want to really calm the environment down, create a restful environment, a darker room, turn the temperature down 1 to 2 degrees Celsius, and that'll just help get the room conducive to sleep. Physical activity can help sleep, but during the day, don't do it before bed in the evening. And physical activity helps to stimulate the metabolism, and it can help with sleep as well. The proper posture for sleep is important. So we don't want to see a posture where the back is out of alignment and it's putting pressure on the neck or the upper back, pinching nerves. That'll be counterproductive to the sleep process. So we definitely want to have good sleep posture as well. And generally, I tell patients that when they're in pain, to sleep on the opposite side. So if you have pain in the left shoulder, the left side of the neck, don't sleep on the left side, but sleep on the right side or on your back. So it all depends on where the pain is, but we want to avoid pinching that area. Body weight's important. So some people that come in the clinic, they want to get in better shape, they want to lose some weight, and that does help joint health. Because if there's too much weight on the joints, and especially if you have poor posture, it can break the joints down and cause the arthritic process. So some of the things that we talk about in the clinic, either during my webinars or during one-on-one consultations, is understanding macronutrients, and that includes carbohydrates, that includes protein, fat, and fiber, and then getting the right ratios, and then understanding calories as well. So calories are units of energy, and depending on how much weight you want to lose over what period of time, definitely understanding your calorie intake, some caloric deficit, and then a lower carb diet, so there's not so much sugar in the bloodstream, is a good way to go. I did write a book about losing weight. I personally lost 32 pounds in 100 days in 2021. And I wrote a book about it on Amazon called The 100-Day Diet. And I'm just working on another book right now that should be published in November, and I'll show it to you in a sec. And it's about joint health and weight loss. So I'll talk to you about that in one sec. But some other things you can do, including the lower carb diet, is intermittent fasting, increasing your fiber, 20 to 30 grams per day generally is a good idea. Increasing high quality protein like fish and like lean meats, tofu. I like nuts, have a lot of protein too, and healthy fats. Again, like fish oil, avocado oil, olive oil. These are good oils to consume because they really help your body to stay strong and feed the joints the right nutrition that it needs. And then making some lifestyle changes, just avoiding things that are bad for your joints, any toxins like smoking, or lots of stress. And we're going to talk about that in a second. So stress, what do you need to know about stress? I think everybody has stress, but when stress is constant and it's unresolving, then it can cause inflammation and it can affect and slow down the healing process. So where does stress come from? Well, family issues, relationship problems, financial difficulty, work stress, life changes, health problems, fear and uncertainty, attitudes and perceptions, desire for social approval, death of a loved one. Certainly my patients have had pretty much all of these in the last month, I would say. I've had different patients come in with different issues. So addressing the causes of stress, understanding how stress affects our joints, and then what you can do about it is good. Now, stress stimulates the nervous system. So when you have stress, it sends signals to the body, specifically the sympathetic nerves, which are the stress nerves in the body. And then what it can do is dilate your pupils, inhibit salivation, relax airways, increase heartbeat, inhibit activity of your stomach, stimulate release of glucose, inhibit the gallbladder, inhibit activity of intestines, secrete epinephrine and norepinephrine, relax the bladder. So these are some of the symptoms that you can, or some of the physiological changes that you can experience if you have a lot of stress on a daily basis and it's prolonged stress. So we want to balance the sympathetic and parasympathetic nervous system. We want to make sure you're addressing the stress issues. And then here's some suggestions for you. So physical activity can help with stress, a balanced diet, minimizing screen time, sleep, meditation can be good. I personally really like meditation, and I use an app called Apple Fitness Plus for doing meditation. It's kind of like a guided meditation on Apple Fitness Plus. And I usually do that on my lunchtime. So that's a great app if you have Apple. Social connections are important. So either volunteering or being in groups. Relaxation exercises, which includes deep breathing, stress reduction techniques, and stretching. So these are very good ways to help reduce stress and to combat some of the symptoms that result from the stress response. Now, joint pain. Here's some tips. Keep moving because you need circulation in your joints to help with joint pain. There's mechanoreceptors in the joints that are movement receptors that are more powerful with their signals than the pain receptors in the joint, which are called nociceptors. So the more movement, it kind of blocks the pain receptors. So I know at the beginning when a patient comes in, they're in a lot of pain, they just need relief, and definitely chiropractic and my care can provide that. But as the care proceeds, I encourage my patients to keep moving because it's going to help to increase the joint health, the circulation of the synovial fluid, and block some of those pain signals as well. Movement provides good nutrition to your joints, and then taking supplements and having a very good diet can be beneficial. I like supplements when the diet is deficient in a certain area, so sometimes it's hard to cover everything with your diet on a regular basis. So for example, we used collagen today as a supplement. I talked about magnesium. If you're not getting enough in your diet, it's good to take a supplement, especially with certain ingredients that are good for your joint health. Stretches and strengthening are important. We didn't talk about core strength today, but maybe at the next Lunch and Learn, we can discuss core strength, getting enough rest, and staying regular with chiropractic care. You know, initially when you come in, pain relief is the number one goal, but then as you progress with the care and the pain decreases, correcting the underlying cause of the pain, restoring the alignment and posture, the flexibility of the spine and the joints, and then last, lifestyle changes to support that can correct the underlying condition and maintain a healthier lifestyle going forward. And that's definitely what we want to see for you. Initially, you might have to come weekly to the clinic, but then eventually coming monthly is a good idea. The book that I'm writing, The Joint Solution, will be out in November. It'll talk about a simple plan to reduce inflammation, shed pounds, and relieve arthritis pain. So I'm just putting the final touches on the title of the book, the cover of the book. I would like to know your thoughts. What do you think of the cover and the title and the subtitle? Because there's still some last minute changes that are being made to the book. But it's going to talk about some of the similar concepts that we talked about today, and it'll be available in ebook, audiobook, and paperback. I'm going to get some copies for the clinic, so if you want to get the paperback version, you can certainly get it here in the clinic. So in conclusion, lifestyle changes can benefit joint health. If you have any questions, you can let me know right now. I'm just watching the chat. If not, you can ask me at your next appointment in the clinic. And I want to thank you for joining me today. Hoping to do more of the Lunch and Learns coming up in the next few weeks and months until the end of the year. And then if you have any suggestions regarding topics, please let me know, because I'd be happy to include those in the future Lunch and Learns, as well as the time that we put on the live webinar. Today we did it on a Saturday at 11:30 a.m. Pacific, but if there's other times that are better for you, please let me know as well. Our contact info here, you can phone or message at 250-486-0062. Usually we'll respond to messages fairly quickly. Sometimes for phone calls, you'll have to leave a message. We'll get back to you in between patients. So please feel free to message us anytime. The website is touchstreetfamilychiropractic.com, and you can see the different services we have to offer, the products we have, and then you can book an appointment there as well. Whether you're a new patient or an existing patient, we are accepting new patients right now. And often we have a special offer, like this month, 10% off. So if you're new to the clinic and you'd like to come in, when you're booking your appointment, in the appointment notes online, type in the month, the current month, and then 10%. And we'll know you watched the video and that you want that 10% offer. You can also add some notes as far as why you're coming to the clinic. And you can also talk about this specific Lunch and Learn, because we'd like to know if people are watching our videos and definitely want some feedback on them. So thank you very, very much for joining me today. I hope